Hi, my name is Lindsay Mitchell. I'm going to be doing IV primary fluid today. I've already been to the Pyxis, done my first and second check. I've checked for expiration, sedimentation, clarity. I've done assessment for allergies, and now we're back at the bedside. I'm going to perform my third check here with the MAR and the patient's bedside, do 2 identifiers, give patient education about why they're getting this medication, which is normal saline, and they're getting it to maintain hydration. I'm also going to let them know that they could experience side effects, which would include fluid volume overload or shortness of breath, and I'll be sure to educate them about that as well. So I would assess the IV site for any signs and symptoms of infiltration, infection, anything like that. I'm going to scrub the hub vigorously and check air bubble. Good. And then I'm going to aspirate.
What do you have to say?
And now that I've aspirated, I'm going to flush and make sure everything's flushing smoothly. It is. I'm going to do the full 10 ml. I'm also going to leave this here for sanitary purposes while I set up my IV tubing. Being sure not to touch these 2 after they've been opened. Okay. All right. Now we're going to squeeze the chamber and set this up. Make sure this is clamped. There it is. All right. Okay, now we will do our priming. Loosen the end of this. Hold it over a trash can and prime our tubing. Watch for any air bubbles while we're tracing our line. All right, and we are there. Perfect, okay. Now, the world isn't made for left-handed people. All right, okay, now that this is here, I'm going to attach it to my patient, being sure not to touch the 2 ends together. That is very tight. All right, perfect, and now we will set up our pump system on. And I'm going to use my MAR again to program the pump. And we're going to say this is not a new patient. Yes, this is Med-Surg. We're going to go to channel select and guardrail IV fluids. We're going to scroll down to normal saline because that's what it says on our MAR here. Yes, our rate according to the MAR is 100 ml per hour. The VTVI is also 100 according to the bag. We're going to start and we're going to unclamp. And wait for our first drip. Okay, we have our first drip. I'm going to document. I'm going to label my bag, no medications added, my name and date and time, and I'm also going to label the tubing. It's good for 96 hours, so I'm going to put the day that I put it on and the day that it ends and document, and I am hand hygiene, lower the bed, and I am done.